Over the last few months, a massive wave of transdermal weight loss patches has flooded UK social media feeds and targeted ads, all claiming to deliver the effects of popular weight loss drugs through a simple sticker on your skin. The psychological hook is powerful. These patches promise the metabolic benefits of top-tier medications while entirely bypassing the pain of needles, the high financial cost, and the medical gatekeeping of prescription injections. But the marketing promise of injection-level weight loss collides hard with the actual ingredient list on the back of the box. These products do not contain prescription drugs like semaglutide. Instead, they rely heavily on berberine, a plant extract known for its mild blood sugar regulation. This diagram shows a cross-section of the skin barrier, illustrating a severe biological limitation. Genuine GLP-1 molecules are incredibly large. Topically applied, they bounce off the tough epidermis, while only trace herbal compounds slip through. Because of this bottleneck, transdermal patches cannot replicate a true subcutaneous needle, which easily bypasses the skin barrier to deliver a complete medical payload. The ultimate trade-off for this needle-free convenience is trading clinical certainty for biological limitation. You avoid the injection, but you also avoid the guaranteed absorption. The UK's Medicines and Healthcare Products Regulatory Agency, the MHRA, and medical professionals across the country maintain a strict stance. There are absolutely zero approved transdermal GLP-1 medicines available on the market today. To sell these products legally, companies utilize a specific regulatory loophole. By categorizing their patches as herbal supplements intended for general metabolic support, they bypass the rigorous clinical trials required for actual pharmaceuticals. This leaves the budget-conscious consumer facing a difficult choice. You have to decide if spending £15 to £25 on a monthly supply is a harmless wellness experiment or a complete waste of money fueled by the placebo effect. Without clinical oversight, consumers are left navigating a pharmaceutical Wild West that masquerades as accessible, highly regulated healthcare. We start with Kind patches, the dominant volume leader on Amazon UK, retailing for around £12 to £15 for a 30-day supply. Notice the brand's strategic packaging terminology. They actively pivot between labeling the exact same product as GLP-1 patches and berberine patches, depending on the listing, relying on the consumer to associate the plant extract with the prescription drug. The most consistent positive feedback from verified users centers on a rapid reduction in food noise, that constant mental chatter about eating, along with a noticeable infusion of clean, jitter-free energy throughout the day. The daily application method requires users to peel and stick one of these textured pink patches every morning. The act itself serves as a daily physical reminder of a user's wellness goals, keeping their diet top of mind. However, the product carries critical drawbacks. There are frequent, verified reports of painful skin burns at the application site. Furthermore, long-term users frequently warn that actual, measurable weight loss over multiple months is minimal to non-existent. Kind patches operate effectively as an herbal energy booster with some appetite suppression, but they fail completely as a guaranteed metabolic replacement for clinical drugs. Next is the Ladisa GLP-1 support patch, heavily marketed online as the entry-level £15 to £20 alternative. The brand relies on slick marketing imagery, directly contrasting a dissolving, highly medicalized 3D rendered pill with the reality of slapping their teal sticker on your arm. A minority of users do report a gentle wearing experience and praise the company for clear ordering instructions and fast delivery, but the negative outcomes are severe.
A significant portion of buyers report zero appetite suppression, with some verified reviews highlighting instances of actual weight gain while relying on the product. These failures are compounded by physical risks. Users report physical skin scabbing after removing the adhesive, paired with completely unresponsive customer service when requesting refunds for the damaged skin and faulty product. The slightly lower price point ultimately masks an unacceptably high risk of adverse skin reactions and yields zero reliable metabolic return. Gentle patches occupy the £15 to £25 mid-tier space, specifically targeting the vegan demographic seeking products without synthetic fillers. The company leverages its packaging to project a premium, health-conscious authority in a budget market, prominently featuring a black badge to highlight its vegan and clean formula. They make specific physiological promises right on the listing. They claim their patches boost metabolism, help control cravings, and actively support natural GLP-1 production in the body. One distinct advantage is the high quality of their adhesive. Because the patches stay firmly attached all day, users are more likely to build a consistent daily routine without the frustration of the product rolling off their skin under clothing. Yet, a clean ingredient list does not equal scientific validation. Medical experts and online pharmacy doctors repeatedly note that zero clinical proof exists to verify that transdermal herbal patches can naturally stimulate GLP-1 hormone production. Gentle patches provide a premium-feeling psychological placebo that supports a mindful daily lifestyle, but the product lacks genuine medical efficacy. Finally, we evaluate Viori GLP-1 patches, the budget champion of the category, offering a massive 60-day supply for roughly 13 to 18 pounds. They distinguish themselves with a complex 23-in-1 formula. The front of their packaging specifically highlights the inclusion of L-glutamine, an amino acid, and Garcinia, alongside the standard berberine extract. This exploded schematic details their specific construction, showing a nutrient formula layer sandwiched securely between the backing and contact layers. This design earns them top reviews for all-day adhesion. However, this complex formulation faces intense scrutiny. Market analysts and regulatory watchdogs flag their aggressive marketing as deceptive, pointing out the complete absence of peer-reviewed studies proving that a 23-ingredient herbal mix can absorb effectively through the skin. While Viori certainly stretches the consumer's pound the furthest, that money ultimately just buys a highly adhesive, entirely unproven herbal sticker. Across all four market leaders, the data reveals a collective failure to deliver authentic GLP-1 agonism or mimic the physiological effects of prescription medication. This chart maps return on investment. All four patch brands cluster in the bottom left. Low financial barrier, but low physiological reward. They merely act as a psychological commitment device. Adding genuine prescription medications to the top right reveals the massive clinical gap. A 15-pound investment pays for a psychological wellness trigger to help you stick to your diet. It does not pay for a physiological overhaul. Our final verdict: for budget-conscious buyers who understand they are purchasing mild, herbal wellness support rather than a medical intervention, Kind patches are the safest bet due to their sheer volume of positive user feedback regarding energy and appetite. But here is the stark medical reality. Anyone seeking serious, clinically significant weight loss must skip transdermal patches entirely and consult a doctor. The convenience sold in viral TikTok videos cannot override fundamental biological safety and proven clinical science. In the high-stakes world of weight loss and metabolic health, if a 15-pound sticker seems too good to be true, it biologically is.